This is the lumbar spine series. To the left we have our obliques, our right and the left oblique. These were AP obliques. Alright, you want to be able to count all 5 lumbar vertebrae. You want to be able to see your Scotty dogs on these. So, counting our vertebra, here's our first ribs. Our last rib, so we know this is T12, so this next one will be L1. So L1, 2, 3, 4, 5. Okay, so we do have all vertebra here, and we also have all vertebra on this left. Now, when you're looking at your Scotty dogs, I'm going to trace some of these, make sure that you can identify the Scotty dog. But you'll see the ear, the nose, and then the front leg. Here's the eye, ear, nose, front leg, there's the eye. So you see these going all the way down. Now, the structures that we are looking at, the ear is the superior articulating process. The nose is the transverse, the front leg is the inferior articulating process, the eye is the pedicle. This area where the neck would be on the dog, that's the pars. Okay. Whenever there's a dark density in this area here, that's an indication the bone is not intact, so there's a pars defect. So this is called our pars interarticularis that the doctor's evaluating to look for that defect. Now on this image, I do not see any of the defects. I do have a little artifact here that it looks like a little scratch that occurred on our film. But always look for your Scotty dogs. Where the articulating process, where the superior meets the inferior, these are our joints called the zygapophyseal joints. So our obliques are evaluating, we're looking at the zygapophyseal joints as well as looking at the pars. Now when we do the AP obliques, we are seeing the zygapophyseal joints that are closest to the IR when you do the AP oblique. Now when we compare these two APs, one of these is good, one of these is not good, and you can tell by looking at these that this is your better one because this spine is not straight. So always double check, make sure your patient is lying straight on the table. Want to be able to count all 5 vertebrae, so you look for that last thoracic rib and then count L1 on the vertebra below that. On our AP, you will see these teardrops in the middle, which that is our spinous process. Okay. This is our vertebral body here. Okay, that's our spinous process. This is our transverse process. These are our pedicles. Okay, and then this area of bone leading to the spinous process is our lamina. So, APs, check, make sure you can count all 5, make sure that your spine is straight. Alright, this is our L5, S1 spots. One of these is good and one is not. This is our better image. The reason is we can see intervertebral disc space at L5, S1, and that's what the radiologist is wanting to see. So make sure you can see the posterior elements too, because some people like to collimate real tight and it's real easy to cut off this back portion. So have it open enough to include the spinous process as well. But here we see our intervertebral disc space, here we do not. So do not turn in an image like that to your doctor because they will want another one. Looking at our lateral lumbar spine, you want to be able to count all 5 again. So here's our sacrum, L5, 4, 3, 2, 1. Have a little artifact again. On this image, you're going to want to see intervertebral disc spaces. You want to see intervertebral foramina. Okay. I'm going to draw out here. This is the vertebral body. Okay. This area bone right here, that's your pedicle. Your spinous process is right here. And then the transverse process in the lateral, it kind of gets lost. You don't see it very well as you do on the AP. You can see this is our superior articulating surface, and it's going to meet our inferior articulating surface there. But this area here, that's our intervertebral foramen. So you'll see those open the best on this lateral lumbar.